Hello all, welcome back to Nursing Guru. Today's topic is infection and the terms related to it. Let's move on to the video. What is infection? Infection is the growth of microorganisms in body tissue where they are not usually found. Now let's learn a few terms related to infection. Infectious agents. Microorganisms is called infectious agents or the source, a germ, a virus or other microbes. Asymptomatic. If the microorganisms produces no clinical evidence of the disease, the infection is called asymptomatic or subclinical. Disease. A detectable alteration in the normal tissue functioning is called disease. Virulence. Microorganisms vary in their virulence as their ability to produce the disease, the severity of the disease they produce, and their degree of communicability. Pathogenicity. Pathogenicity is the ability to produce disease. Thus, a pathogen is a microorganism that causes a disease. Asepsis. Asepsis is the freedom from disease-causing microorganisms. Aseptic technique is used to decrease the possibility of transferring microorganisms from one place to another. Medical asepsis. Medical asepsis includes all practice intended to confine a specific microorganism to a specific area, limiting the number, growth, and transmission of the microorganism. Surgical asepsis. Surgical asepsis or sterile technique refers to those practices that keeps an area or an object free of all microorganisms. It includes practices that destroys microorganisms and spores. Sepsis. Sepsis is a condition in which an acute organ dysfunction occurs secondary to infection. Now, let's learn the types of microorganisms. Four major categories of microorganisms that cause infection in humans are bacteria, viruses, fungi, and parasites. Bacteria. Bacteria are by far the most common infection-causing microorganisms. Several hundred species can cause disease in humans and can live and be transported through air, water, food, soil, body tissues and fluids, and inanimate objects. Viruses. Viruses consist primarily of nucleic acid and therefore must enter living cells in order to reproduce. Common virus families include rhinovirus, cold, hepatitis, herpes, and human immunodeficiency viruses. Fungi. Fungi includes yeast and molds. Candida albicans is a yeast considered to be normal flora in the human vagina. Parasites. Parasites live on other living organisms. They include protozoa such as the one that causes malaria, helminths in worms, and arthropods in mites, fleas, and ticks. There are different types of infection that cause when newly introduced or resident microorganisms succeed in invading a part of the body where the host defense mechanisms are infective and the pathogen causes tissue damages. Local infection. A local infection is limited to a specific part of the body where the organisms remain. Systemic infection. If the microorganisms spread and damage different parts of the body, the infection is systemic infection. Bacteremia. When a culture of a person blood reveals microorganisms, the condition is called bacteremia. Septicemia. When the bacteremia results in systemic infection, it is referred to as septicemia, which has become common over the time. Acute infection. Acute infections generally appear suddenly and last for a very short time. Chronic infection. A chronic infection may occur slowly over a very long period and may last for several days or months or years. Now, let's learn about the chain of infection. The chain of infection is made up of 6 links, namely etiologic agent, reservoir, portal of the exit from the reservoir, method of transmission, portal of entry to susceptible host and susceptible host. Etiologic agent. The extent to which any microorganism is capable of producing an infectious process depends on the number of microorganisms present, the virulence and the potency of the microorganism, the ability of the microorganism to enter the body, the susceptibility of the host, and the ability of the microorganism to live in the host's body. Reservoir. Reservoir are sources of microorganisms. Common sources are other humans, the client's own microorganisms, plants, animals, or the general environment. A carrier is a person or animal reservoir of a specific infectious agent that usually does not manifest any clinical signs of the illness. Portal of exit from reservoir. Before an infection can establish itself in a host, the microorganism must leave the reservoir. Common human reservoirs include respiratory tract, GI tract, urinary tract, reproductive tract, blood and tissues. Method of transmission. After a microorganism leaves its source or reservoir, it requires a means of transmission to reach another person or host through a receptive portal of entry. There are three mechanisms: direct transmission, which involves immediate and direct transfer of microorganism from person to person through touching, biting, kissing or sexual intercourse. Indirect transmission may be either vehicle-borne, any substance that serves as an immediate means to transport and introduce an infectious agent into a susceptible host through a suitable port of entry, or vector-borne, an animal or flying or crawling insect that serves as an immediate means of transporting an infectious agent. Airborne transmission may involve droplets or dust, such as a droplet nuclei, the residue of evaporated droplets entitled by infectious hosts such as someone with tuberculosis can remain in air for long periods. Portal of entry to susceptible host. Before a person can become infected, microorganisms must enter the body. Often, microorganisms enter the body of the host by the same route they use to leave the source. Susceptible host. A susceptible host is any person who is at risk for infection. A compromised host is a person at increased risk, an individual who, for one or more reasons, is more likely than others to acquire an infection. Now, defenses against infection. Individuals have defenses that protect the body from infection. They are categorized as non-specific and specific defenses. Non-specific defenses. Non-specific defenses protect the person against all microorganisms regardless of prior exposure. They include anatomic and physiologic barriers and inflammatory responses. Anatomic and physiologic barriers. Intact skin and the mucous membrane are the body's first line of defenses against microorganisms. The nasal passages have a defensive function. Moist mucous membranes and cilia to trap microorganisms, dust and foreign materials. The lungs have alveolar macrophages, large phagocytes. Phagocytes are cells that ingest microorganisms, dead cells and foreign particles. The oral cavity regularly sheds mucosal epithelium to get rid of the mouth colonizers. The flow of saliva and its partial buffering action help prevent infections. Saliva contains microbial inhibitors such as lactoferrin, lysozyme and secretory IgA. The eye is protected from infection by tears, which continually wash microorganisms away and contain inhibiting lysozyme. The high acidity of the stomach normally prevents microbial growth. The resident flora of the large intestine help prevent the establishment of disease-producing microorganisms. Peristalsis also tends to move microbes out of the body. When a girl reaches puberty, lactobacilli ferment sugars in the vaginal secretions, creating a vaginal pH of 3.5 to 4.5. This low pH inhibits the growth of many disease-producing microorganisms. The entrance to the urethra normally harbors many microorganisms. Urine flow has a flushing and bacteriostatic action that keeps the bacteria from ascending the urethra, and intact mucosal surface also acts as a barrier. Inflammatory response. Inflammation is a local and non-specific defense response of the tissue to an injurious or infectious agent. It is an adaptive mechanism that destroys or dilutes the injurious agent, prevents further speed of the injury, and promotes the repair of damaged tissue. First stage, vascular and cellular responses. This is a constriction of blood vessels, dilation of small vessels, increased vessel permeability, increased leukocytes, swelling and pain. Leukocytes begin to engulf the infection. Second stage, exudate production. This stage is characterized by exudation with fluids and dead cells. Serous, clear part of the blood. Purulent, thick pus with leukocytes, and sanguineous, bloody. Third stage, reparative phase. The repair of tissues. Examples are regeneration, same tissues, stroma, connective tissues, parenchyma, functional part, and fibrous scar. Specific defenses. Specific defenses of the body involve the immune system. The immune response has two components: antibody mediated defenses and cellular mediated defenses. Antibody mediated defenses. Another name for the antibody-mediated defenses is humoral or circulating immunity, because these defenses reside ultimately in the B lymphocytes and are mediated by the antibodies produced by the B cells. Active immunity. In active immunity, the host produces antibodies in response to natural antigens, example infectious agents, or artificial antigens, example vaccines. B cells are activated when they recognize the antigen. They then differentiate into plasma cells. The B cell may produce antibody molecules of 5 classes of immunoglobulins: IgM, IgG, IgA, IgD, and IgE. Passive immunity. With passive or acquired immunity, the host receives natural antibody, example from nursing mother, or artificial antibody from an infection of immune serum. Cell-mediated defenses. The cell-mediated defenses or cellular immunity occur through the T cell system. On exposure to an antigen, the lymphoid tissues release a large number of activated T cells into the lymph system. These T cells pass into the general circulation. There are 3 main groups of T cells: helper T cells, cytotoxic T cells, and suppressor T cells. Helper T cells help in the function of the immune system. Cytotoxic T cells attack and kill microorganisms and sometimes the body's own cells. Suppressor T cells suppresses the function of the helper T cells and cytotoxic T cells. The major goals are maintain or restore defenses, avoid the spread of infectious organisms, reduce or alleviate problems associated with the infection. Factors increasing susceptibility to infection. First is age. Throughout the lifespan, susceptibility to infection changes. Newborn infant has immature defenses against infection, as he is born with only the antibodies provided by the mother. Hand hygiene. It is important for both the nurses and the client's hands to be cleansed at the following times to prevent the spread of microorganisms. Nutrition. A balanced diet enhances the health of all body tissues, helps to keep the skin intact, and promote the skin's ability to repel microorganisms. Adequate nutrition enables tissues to maintain and rebuild themselves and helps keep the immune system functioning well. Fluid. Fluid intake permits fluid output and flushes out the bladder and urethra, removing microorganisms that can cause an infection. Sleep. Adequate sleep is essential to health and to renewing energy. Stress. Excessive stress predisposes people to infection. Nurses can assist the clients to learn stress-reducing techniques. Immunizations. The use of immunizations has dramatically decreased the incidence of infectious diseases. It is recommended that immunizations begin shortly after the birth and be completed in early childhood, except for boosters. Disease process. Patients with diseases of the immune system are at particular risk for infection. Example, leukemia, AIDS, lymphoma and aplastic anemia. Sterilization. It is a process that destroys all microorganisms including spores and viruses. Medical therapy. The immune system attacks foreign bodies to prevent infection from spreading. Infection prevention and control. It is not always possible to know which clients may have infectious organisms. A set of guidelines has been established by the CDC and other organizations outlining steps all healthcare workers must follow to reduce the chances that organisms in blood and potentially infectious organisms from other body tissues will be transmitted from the client to other individuals. Standard precautions. These are used in the case of all hospitalized individuals, regardless of their diagnosis, possible infection status, and designed for all clients in the hospital. These precautions apply to A. Blood, B. All body fluids, excretions and secretions except sweat, C. No intact broken skin, and D. Mucous membranes. Designed to reduce a risk of transmission of microorganisms from recognized and unrecognized sources. Perform hand hygiene after contact with blood, body fluids, secretions and excretions and contaminated objects whether or not gloves are worn. Wear clean gloves when touching blood, body fluids, secretions, excretions and contaminated items. Wear mask, eye protection or face shield if splashes or sprays of blood, body fluids, secretions and excretions can be expected. Wear a clean, non-sterile water-resistant gown if client care is likely to result in splashes or sprays of blood, body fluids, secretions or excretions. The gown is intended to protect clothing, handle client care equipment that is soiled with blood, body fluids, secretions or excretions carefully to prevent transfer of microorganisms to others and to the environment. Handle all soil linen as little as possible. Place used needles and other sharps directly into puncture-resistant containers as soon as the use is completed. Personal protective equipment. All healthcare providers must apply PPE according to the risk of exposure to potentially ineffective materials. Gloves. Gloves are worn for three reasons. First, they protect the hands when the nurse is likely to handle any body substances. Second, gloves reduce the likelihood of nurses transmitting their own endogenous microorganisms to individuals receiving care. And third, gloves reduce the chance that a nurse's hands will transmit microorganisms from one client and object to another client. In all situations, gloves are changed between client contacts. The hands are cleansed each time the gloves are removed for two primary reasons. 1. The gloves may have imperfections or may be damaged during wearing so that they could allow microorganisms entry. And second, the hands may become contaminated during the glove removal process. Gowns. Clean or disposable, impervious, water-resistant gowns or plastic aprons are worn during procedure when the nurse's uniform is likely to be soiled. Sterile gowns may be indicated when the nurse changes the dressings of a client with essential wounds. Single-use gown techniques, using a gown only once before it is discarded or laundered, is the usual practice at hospitals. Face masks. Masks are worn to reduce the risk for transmission of microorganisms by the droplet contact or airline routes or by the splatters of body substances. The CDC recommends that masks be worn by those close to the client if the infection is transmitted by large particle aerosols. Large particle aerosols are transmitted by close control and generally travel short distances about 1 meter to 3 feet by all individuals entering the room if the infection is transmitted by small particle aerosols. Small particle aerosols remain suspended in the air and thus travel great distance in the air. Eyewear. Protective eyewear, goggles, glasses, face shields and masks are indicated in situations where body substances may splatter to the face. If the nurse wear prescription eyeglasses, goggles must still be worn over the glasses because the protection must extend around the sides of the glass. Nosocomial and health-related infections. Nosocomial infections are classified as infections that originate in the hospital and is a subgroup of healthcare associated infections or HAIs. Urinary tract. The most common microorganisms in the urinary tract include Escherichia coli, improper catheterization technique, Enterococcus species, contamination of closed drainage system, and Pseudomonas aeruginosa, inadequate hand hygiene. Surgical sites. The most common microorganisms in surgical sites include Staphylococcus aureus, including MRSA, inadequate hand hygiene, Enterococcus species, including vancomycin-resistant strains, improper dressing change technique, and Pseudomonas aeruginosa. Bloodstream. The most common bloodstream microorganisms include coagulase negative staphylococci, inadequate hand hygiene, Staphylococcus aureus and Enterococcus species, improper intravenous fluid taking and site care technique. Pneumonia. The most common causative microorganisms for pneumonia include Staphylococcus aureus, inadequate hand hygiene, Pseudomonas aeruginosa and Enterobacter species, improper suctioning technique. Body defenses against infection. The microorganisms are present everywhere from bacteria to viruses to fungi. Most of them are perfectly harmless, but there are some that can harm the body, and it's because of these pathogenic organisms our bodies have a sophisticated set of defense system both inside and outside. Immunity. It is the ability of an organism to resist disease produced in response to natural exposure or inoculation, active immunity, or by the injection of anti-serum or the transfer of antibodies from mother to her baby via placenta or breast milk. Passive immunity. External defense system. The first line of defense includes physical and chemical barriers that are always ready and are prepared to defend the body from infection. These include skin, tears, mucus, cilia, hydrochloric acid in the stomach, urine flow, and white body cells called neutrophilia. These include skin, tears, mucus, cilia, hydrochloric acid in the stomach, urine flow, and white blood cells called neutrophils. Pathogenic microorganisms must cross the first line of defense. If this defense is broken, the second line of defense within the body is activated. Skin. The skin is the largest organ of the body. It acts as a barrier between pathogens and the body. The skin forms a waterproof mechanical barrier. Microorganisms that live all over the skin can't get through the skin unless it is broken. Tears, mucus, and saliva. The eyes, nose, and mouth are entry paths for pathogens. The tears, mucus, and saliva contain an enzyme that breaks down the cell wall of many bacteria. Those that are not killed immediately are trapped in the mucus and swallowed. There are special cells that line and protect the nose, throat, and other passages within the body. The inner lining of the gut and lungs also produce mucus to trap invading pathogens. Cilia. The cilia lining the respiratory tract move mucus and trap particles away from the lungs. Particles may be bacteria or material such as dust or smoke. So, we have come to an end of this topic. In this topic, we discuss about infection, types of microorganisms, types of infections, the ways to prevent it, and much more. If you have any doubt related to this topic, please comment it below. And for more such videos, subscribe to our channel Nursing Guru. Bye.